Good afternoon, everyone. My name is Erika Parks. I'm going to be your moderator today. I am a Georgia graduate. It's been a decade. I can't believe it. I graduated 10 years ago from UGA with my master's in public health and health policy and management. We are so happy to have you all here with us today at our second Black Alumni Connection series. Our guest speaker for today is Erika Watkins. But before we get into that, I want to just remind you that here at the College of Public Health, diversity and inclusion is at the core of everything that we do. And so this is one of the reasons why we started the University of Georgia College of Public Health Working Group, which will be forming into a board for the next fiscal year coming up 2021. I want to share with you all our mission so that you can know a little bit about who we are and what we do. Our mission is to unite a network of dedicated alumni to create programming and engagement opportunities for our community of alumni, students, and faculty to connect and show their commitment to the UGA College of Health. The Black Alumni Connection series is something that we just started this year, actually about a month ago. And so the reason why we do this is for commemorating the 60th anniversary of desegregation and honoring UGA public health change makers of color. And so I am going to start off reading you Erika Watkins' bio, and she is going to give us a overview. Erika Watkins is a commercial claims adjuster for the Donegal Insurance. She has 21 years of experience in the insurance industry with expertise in liability, exposures, claims, litigations. She was born and raised in Decatur, Georgia. Erika graduated from Towers High School in 1994. She attended the University of Georgia from 1994 to 1999. While at UGA, she served as president and assistant in Brumby Hall, was involved in the Black Educational Support Team and Black Affairs Council, and was a member of the Eta Xi chapter of Alpha Kappa Alpha Sorority Incorporated. She graduated from UGA with a bachelor's in education and health promotion and education in 19. Welcome, Erika Watkins, to the Black Alumni Connection series.
Thank you. Thank you. I appreciate the opportunity to be here and to speak with you this afternoon. I loved my time at the University of Georgia. It was just the best 4 to 5 years I had at that time in my life. And interestingly enough, when I first attended University of Georgia, I actually came in as a chemistry pre-nursing major and decided about a year later that, I'm not sure if it's going to really work with nursing because I don't know if I can really deal with the bodily fluids, the hands-on touching. It's just my perspective kind of changed on it. But I knew that I wanted to stay within the science, health field in some form or fashion, just not necessarily with direct patient care. And so when I discovered that Georgia had a program for health promotions and behaviors, I changed my major to that and was excited to learn how to research, implement, execute public health programming. And during my time at University of Georgia, the health promotion and behavior major was in the College of Education. So I was given the option to pursue either a school track or a corporate track. So I chose the corporate track in my health promotion studies at the University of Georgia, which was very comprehensive and it was a very excellent program. It wasn't a huge number of us in the program, but the classes were small. We got lots and lots of hands-on instruction, opportunities to research and present our findings to our classmates. So I really enjoyed being in health promotion at Georgia.
Thank you, Erika, and we're so excited to have you here. Before we get started into our questions, I want to take this time and introduce to you all some of our other alumni working groups. I'm going to start with Kim or Lori.
Hi, good afternoon, everybody. My name is Lori Elmore, and I am one of the members of the College of Public Health Alumni Working Group. But I actually graduated from UGA around the same time that Erika did in 2000 in the same major. I'm happy to be here today. And today I work, Actually, I worked for CDC, Centers for Disease Control and Prevention, for the last 17 years. So I've been in federal government for that long. So it's nice to virtually meet everybody today and looking forward to the discussion.
I'm Kim Metcalf, and I have bachelor's and master's degrees in environmental science here from UGA. I have started my own business 20 years ago, so I have my degree's emphasis for environmental health science, and so I have an environmental consulting firm and have a couple of folks that work with me, and we work mainly with construction development industry, looking at state waters, wetlands, and protecting those natural resources. And I'm excited to hear this discussion and see what we all learned today. I'm glad to be here. Thanks.
Thank you, Kim and Lori. Do we have any other members that may have checked in before I move on? All right, so you all are in for a treat. It is National Mental Health Awareness Month, and 1 in 5 people will experience a mental health illness during their lifetime. Everyone faces challenges. Everyone faces challenges in life that can affect their mental health. So as a part of Mental Health Week, this week is Mental Health Week inside of the National Mental Health Month. Today's focus is on stress, whether it's depression, anxiety, diminishing your self-worth because you may have had to a career pivot, or you're anxious if you're just graduated and ready to graduate about will there be an opportunity for you in the field that you just received your degree in. No worries, you are in the right place at the right time to have this discussion with us in a safe place, and also to give you some nuggets on how to pivot and thrive through this all. So Erika, tell us how you end up in working in insurance after graduating with a degree in health promotion and behavior.
I had no intentions on ever going into business of that sort or insurance or anything. I really, really enjoyed my studies of dealing with health promotion and behaviors. The internship I had as an undergrad, I actually interned with Emory University School of Medicine, and we dealt directly with programming in rural counties of Georgia, mostly teen programs dealing with STD prevention, smoking cessation, teen pregnancy, study skills, just multiple types of programming in rural areas of Georgia. And I really, really enjoyed being able to meet directly with our program participants and to see what they were learning from the programs and how they were making changes, healthier changes in their lives with it. But what caused the pivot in my career was that at that time, I was a college senior, but I also had a 1-year-old daughter. And so the leadership that I was under at Emory, while I was doing my internship, basically it was a matter of the salary that they were offering for me to continue on working with them in their public health department. It just wasn't sufficient for me to be able to move my life forward, to be able to live independently, take care of my daughter, move to my mother's house. So when the internship ended right before I graduated, me and my leadership, we had a discussion about my performance, and they did offer me a position to come on full time with them at Emory. But the salary was just not competitive enough for me to be able to stay. And just to be frank, we're talking about 1999. And the program leader, she offered me $25,000 as an annual salary. And I was 22 at the time. Like I said, I had a daughter. She was a year old and lived with my parents. I just didn't really understand why the salary was so low. And I did actually expect that the salary would have been higher than what it was. But what she told me flat out was that, well, you're about to be a new grad. $25,000 is good because Emory's only paying me $30,000 and I have a master's degree. And so that was a shock to my system, because in my mind, I'm like, well, why are you working with a master's degree for $30,000 at Emory University? But, you know, she did not have the same life responsibilities that I had to consider in that. And so after pondering the decision on whether to stay or not, trying to ponder from a financial standpoint, would it be feasible for me to be able to move my life forward the way that I needed to take care of myself and my daughter. I decided that I would pursue a career outside of public health education. At the time, after working with Emory for 18 weeks and seeing various opportunities within the public health field, but also being under this time crunch to where I'm about to graduate. I have a daughter. I need to move my life forward. So I decided to check in with a college friend, and he was able to get me on with State Farm because I was like, look, I have a job offer. It's not paying enough. I know I don't know anything about State Farm or anything about insurance, but I heard it's a great company. Do you think you could get me on? And he was able to get me the interview, which led me to being hired fresh out of college at State Farm. So it was just a total and complete career shift, pivot. I've never utilized my health promotion degree besides just having a large body of knowledge about public health, things I could speak on, but in terms of putting it into practice, that was no longer an opportunity because my goal ultimately was once I did finish the program, I did want to work in corporate health and wellness, like run, maybe I've researched major corporations that had health and wellness centers. So my goal was to try to ultimately get to that. While I was hired at State Farm to go into insurance claims, State Farm did have a health and wellness clinic on site. And so in talking to the recruiter and going through the interview process, I did explain that that was my ultimate goal, to try to get into the health and wellness department to be able to execute the health education programming for State Farm employees. Unfortunately, the opportunity never came up in my career at State Farm to actually get into the health and wellness department there. And that department eventually went away. And so in the course of that, that's how I've been in the insurance business for 21 years. Started out 22. I'll be 45 in a couple months. And it's been a very lucrative and very rewarding and challenging career. And that's what's kept me doing insurance for years, insurance claims.
Wow, what an amazing story. I want to check and see if we have any comments or questions in the chat box before I move to the question.
Not yet. None yet.
All right. So Erika, I had a lot of emotions when you're telling your story. So I want you to share with us at that time when you were with your daughter, having to make this decision and hearing, basically this is it. And the leadership telling you, basically, I have been here and only make about 5,000 more than what you're starting out with. And that's you should be excited about that. What were some of your gut feelings at that time? And I ask that because I myself too share having to pivot at first when I graduated with my master's in public health. And I share this and open this conversation up for everyone because I want you all to realize that this is not a hit on any university. It is life. It happens to people at different times. So what were some of your initial thoughts and who helped you to really affirm what you were doing and not try to make you just take the opportunity?
I mean, I definitely talked to my parents about it. I talked to colleagues about it that I was working with at Emory. I talked to other friends about it. And it was a really tough decision because as a young woman on the cusp of graduating from college, a young mother, I'm like, okay, I spent 3 years pursuing public health. And now I'm literally going to jump into another type of career field that I know nothing about. But I know that it's a large company. They pay great salaries. They have great benefits. And that was the impetus. It was just, I needed a job that was going to pay well, provide health insurance for me and my daughter so I could buy a home and move to my mother's house and me and my baby would be okay. So that was really it. It was just thinking about it from a financial standpoint. Like, what can I do right now to help me to move forward in my life and the responsibilities that I have? And so, it's like I said, it's a gut punch when someone's looking at you like, you're crazy for not taking this offer. I have a master's degree and I can make 30. I was like, okay, well, that's what you decided to do, but 30 is not even gonna get it for me right now. So, but there was just no wiggle room in that. So I just had to make that decision. And honestly, thinking back on that time in my life, after hearing like Lori's been at the CDC for 17 years, I honestly never thought beyond receiving that offer from Emory and then reaching out to my friends to get on with State Farm. At that point in my life, I kind of felt like it was a fight or flight. What can I do to move this forward? And when she presented that offer to me of $25,000 back in '99, in my mind, if this is what Emory is offering to work in their public health, in my mind, if I even tried to pursue other public health organizations, I felt that that was probably going to be the salary that I would be looking to be paid in any other public health company I tried to get on with. So I never looked further beyond that time in my life to pursue public health further. I just wanted to move into a full-time career and moving things forward.
Thank you. Do we have a question in the chat box?
Not yet, but I'd just like to make a comment to Erika that I'm just amazed at the poise and confidence that you had in yourself to know your self-worth at that point. You know, I mean, so many people, I think, in your position would have just said, oh, this is what it is. I'll take the job. And it's Emory, which is such a great, you know, name and university. And I just admire that you had the knowledge of your being, that you knew that was not what you were worth, and you were able to step outside that field and move forward. And you know, I don't know if it's just being a mama and that's just what as mamas do, but I'm just really proud to see that you took that step and knew your self-worth. Because I think a lot of times the young females that I speak to at UGA, sometimes I don't know that they have that core inner strength that you had and would have turned that down. So I appreciate you sharing your story with us.
Well, thank you. I appreciate, you know, your insight into that as well, because it was a tough decision because no one, you know, of course you go to college and you're able to change your major as often as you like. But when you think about the totality of your studies and what you actually put into your studies, you don't ever think, I'm going to go to college, I'm going to study this career field. 3 weeks after I graduate, I'm going to go in a totally opposite end of the spectrum than what I've, you know, spent time and money learning. And so it was tough to feel like I just wasted 4 years. Like I have this degree, I'm not doing anything with it besides it being that stepping stone or that thing, that foot to get you in the door for a company to even look at you, that you have a public health degree or a degree in education. I still get questions about it at this point in my life when I interview with jobs. They're like, wow, you have a degree in education? You're a teacher? I was like, no, I was going to be into my plan was to go into corporate health and wellness. But life just, I took a different approach with my career and never worked with it or utilized that degree in education. So.
Although you may have never utilized the degree, but I'm sure you utilized some of the skills that you learned there in your field. So the next question we have for you is, how has being a Black professional shaped your career?
It is very interesting because in insurance, you have what you see in management. You don't see a lot of people that look like me. In insurance, it's typically very male dominated, very white male dominated, especially as you get up the chain of leadership. And so when you're wanting to move up in the insurance industry, working with a big company, as a Black professional, you have to do extra. If you want to be seen or be visible for special projects, you're always feeling like it may not be a project you're really interested in, but you know if you want to get in front of certain members of leadership to have promotional opportunities, you need to raise your hand and try to work on special projects. And also in terms of trying to, whether it's trying to get a promotion or trying to move laterally within a company, you have to set yourself apart by not necessarily wanting to have to do continuing education, but in order for me to be considered for other positions within the company, I had to earn designations. And I have the associate in claims designation that took me a couple years to obtain. And I had the associate in claims management designation. But with State Farm, you were not even going to get an interview if you didn't have continuing education. So having to really balance motherhood, a full-time job, and working on insurance designations, that was a lot because they were all independent studies. They were 8 courses, they were exams. So I have to balance working all day, my daughter's home, helping her with her homework, making sure she's taken care of, but then also sitting down and studying master's level insurance coursework just so that I can be competitive to move forward in my career field. Because had I not obtained those designations, it wouldn't have made me competitive to either leave State Farm and join other companies, because having those set you apart. So you do have to do more and put yourself out there to be able to be put in front of the change makers and the decision makers that can affect your career trajectory. And so in my career, this is my 21st year in insurance claims, I've had 3 people of color that were in management in my entire career. And so in working with them and explaining to them what my goals are, how I like to get into leadership one day, they're like, you have to do X, Y, and Z, and you have to be better than everybody else. Your stuff has to be almost perfect, without reproach in order for you to be considered for anything. So it's always been that we have to do more just to try to move up in the company.
Any questions in the chat box?
No, none yet. And if you'd like to make a comment, feel free to make comments in the chat box as well.
Erika, I admire your resilience, because leaving Georgia and having to pivot, I too share a similar path with you in so many ways as I hear you talk. When I graduated from Georgia, I too went into the insurance industry of Primerica. And it's not a lot of African Americans in financial services. That's where it all falls. And there is a heck of a lot of continuing education that has to happen in order for you to grow and get promotions and to increase your income. Some of them are commission-based. So it is very, very competitive. So I admire your resilience and the walk that you've taken to get all these credentials outside of what you've already done. Because it felt like to me, and let me know if you had a similar experience, that I had just finished my master's. I don't want to go back to school and sit in somebody's classroom. And I found myself sitting again for an exam to get an insurance license. And it's tough because it's foreign, it's Greek, it's not information or language that we use in an African-American community. We don't hear a whole lot of talk about financial literacy and insurance, period. So you had a whole nother monster that you had to tackle.
Yes. And it's challenging because it's insurance. I mean, I love it. I've been doing it so long now, but it's not easy. It's definitely not easy. I mean, continuing education, that's just time you're taking away from your personal life, your home life, having to sit down and focus and study and pass those exams. It was a lot of work. So after I obtained the first designation, the AIC, Associate in Claims, I was like, you know what? I'm good. I have some letters behind my name. That'll at least get me an interview. Okay, may or may not get an interview. Okay, well, let me go and try to get a second one to set me even further apart from the others. Okay, then you get a little bit more traction, a few more interviews. Other companies are starting to look at you. So yeah, it was a lot of work, but I think I'm done. I don't have the capacity to really sit down like that anymore. And it's just something that when you're younger, sometimes it's just, you have that fever and that drive and that desire to have more and more and more and to provide for your family. And I'm like, at this point with 21 years experience, 2 designations, there's nothing you can put in front of me regarding insurance that I can't pick up, that I can't learn immediately. I've been doing it so long. I mean, there's always something new to see within the industry. No 2 claims are alike. Like I handle commercial claims now. So I handle anything from construction projects, highway, pothole damage, water main damage, to commercial auto claims. The Pizza Hut driver hit someone, to slip and fall. So I'm constantly seeing something new every single day, and it keeps it interesting. It's what's really kept me in it, along with it being a very financially stable industry to be in, because a machine can't do what I do. Insurance is an intangible asset people are always having accidents. That's never going to stop. That's never going to go away. So I have career security for as long as I choose to stay in the insurance industry, which was very, very important to me, because I felt if I'm going to completely go away from my undergraduate studies, it needs to be something that I can build upon and stay in for a very long time, because I just didn't want to bounce around a lot. I just want to find a secure, lucrative career field to go into, and that's what it's been for me.
Yes, you spend a lot of time and money. Those licensures and certifications cost. They're not cheap. Absolutely. What would you say today to someone that is maybe anxious about this? What would you say some words of encouragement if they were to be put in the shoes that you faced when you graduated, or someone that is in this seat right now because of the pandemic? When we advertised this, we talked a little about when we sent it to Mental Health America that 66% of unemployed adults, because of the pandemic, have thought about seriously a career pivot. What would you say to someone that's sitting in that seat right now, that's on the edge, but unsure, but know they need to really make a move?
I would just tell them to do their research, because I feel that college trains us for certain fields, of course, but it also shows that you're able to adapt, you're able to absorb and comprehend multiple types of information. You've already taken a gamut of courses, from literature to geology to geography, plus your major courses. So if you're looking to go into something completely different, depending upon how flexible is your life, is it just you that do you have responsibilities that are depending upon you to provide for them? I would just tell them to just step out on faith and see how it goes, because you may get into it, you may absolutely love it and stay with it, even though you didn't get a degree in it. Or you could get in it and say, you know what, this is not for me. It's not what I thought it was. But just take the opportunities that are presented to you and that you go after. And I will also say to honestly network a lot through your social organizations, athletics, clubs, family, friends. Let everyone you know, hey, I'm getting ready to graduate. This is what I would love to do. If you know of anybody in this career field, can you make an introduction? Also utilizing LinkedIn, just heavily utilizing your resources and just trying to see where your life is at. And if your life is in a position where maybe you have parental support that can kind of help, bolster you while you're trying to figure out where you want to go once you're done with college. Or if it's a matter of, I'm about to graduate, my parents can't take care of me no more, I need to just get a job and just, go after that. Or if you may need a little bit more education once you graduated, because my daughter, she's about to graduate from Georgia and she's doing that. We're having these discussions. She very much wants to work in her career field. She's very much looking for jobs in her career field, applying for them, interviewing. But at the same time, we have quite a few members of our family. My daughter's studying fashion merchandising at Georgia. We have quite a few members of our family that are in IT. So they're like, hey, pursue what you love. But at the same time, if it's not working out in a timely fashion for you, you may want to think about going out, not saying enroll in grad school, but maybe just take some certification courses like an IT, take a boot camp to learn some IT skills. You're super smart, you can pick it up. Just think about there are other things you can do while you're still pursuing your dream job in your chosen field of study. And that's just what I'm doing. I'm being supportive of it. I know she wants to work in her field, but I'm like, you're super smart. You can pick anything up. Sometimes you just have to make a decision to try and work with a company that's a great company that's going to provide you great benefits while you're still working on your creative passions on the side. So you may have to work in IT, but it's going to be great for you. You have people that can help you get on with IT, your career, your creative aspirations on the side, work those as multiple streams of income until you can get to your dream job within this dream field that she's wanted to work in fashion her whole life. But, we're just trying to be supportive and just saying sometimes you got to just kind of do a little something on the side while you're trying to make ends meet. So.
Thank you for that. I'm going to check back with the chat box and see if we have any comments or questions there.
We do have a comment. So Bianca Watkins says that Erika is the reason that she's with State Farm today and that her story has been an inspiration. And I echo that. I don't know, Erika, if you are a mentor for young people, but if you're not, you ought to carve out time and do it. You really are, I think, an inspiration and something that young students need to have exposure to, because the attitude that you have is really remarkable, because I think some people might be a little bit bitter if they weren't able to immediately go out and use that degree. And instead, you pivoted, you've made yourself a successful career, and it sounds like you've made yourself an amazing role model to your daughter, who's about to be one of our UGA graduates. And that is amazing and really cool. And when we were talking about you and your story earlier, I had a similar experience at my first real job where they didn't up my salary after I graduated, and I walked away too. And it's a hard thing to do. Mine was with the Georgia Power Company, and I had people in my family who were not supportive of me. And, how dare you leave a good company? And, why do you think you were worth so much more, and right. So I just feel like you are just someone who has walked a really interesting path and set a great example. And I'm just glad to have heard your story today.
Thank you. I appreciate that. My daughter Taylor's in the chat.
I was looking at the chat like, is that your daughter?
Yeah, she says, my mom is the best. I think, Taylor, you're right. Your mom is the best. I mean, this is, and again, not to push you on but UGA has a new mentor program. I don't know if you've heard about it. I'm happy to email you some details, because there are so many young people at UGA, but especially young women who need to hear your story. And especially being a person of color, I think that is so critical for these young women that are looking for a role model, just to hear your story and to know you stepped out of your comfort zone and said, I'm worth more than that, and that they can do that too. That's something these young ladies need to hear. I mean, I'm sure there are young men that would want you as a mentor as well, but I find that I always end up with young women that I mentor, and I really do. I would love it if you could take the time to talk to some of these students, because you really have a great story, and they need to hear that, because I think sometimes, especially as women, we're kind of taught, you take that offer, you should do it, and you had a backbone and said absolutely not. Thank you.
Well, that would be a great opportunity, and I would love to speak with students. Absolutely, I would love to speak with them.
I'll send you some info. Thank you.
Oh, you're welcome. Thank you.
Echo that, Erika. We all know, all the ladies here know, and those that are here as not part of the working group that are here as guests, attendees, that at some point in your career, you will be faced with a decision like this. To have someone like you to walk you through it, prepare you for that time so that you make the right decision for yourself. Because as we're talking about Mental Health Month, it's been Mental Health Awareness Week, there is a lot that is weighted on the person. If they would have taken a different turn from what you took, Erika, if someone would have just took the job because leadership said, hey, you should take this. And just think about you knowing this doesn't meet my needs, and you be hating the decision every day, how disgruntled you could have been, and what that would have done to you, your family, your daughter, who was one at the time, and just the working environment. So it's so empowering to hear someone believe in themselves and make the best decision no matter what someone else thinks. So we can't wait to see who you're going to mentor.
Great.
All right, so this takes me to the final question that we have planned, but we welcome you all in the chat box. Please write your questions, your comments. Our last question, since we've talked about mentorship and alumni coming back and being mentors. Tell us, Erika, what is the importance to you for Black alumni engagement in UGA, and more specifically to the College of Public Health?
It's just important for us as Black alumni to stay engaged with the undergraduates at Georgia, because they need to see and know that we've had the similar experience with them at Georgia. Depending upon what time we came through the University of Georgia, we may have had different challenges academically, socially, even the resources that were available to us at the time compared to what's available to them now. So it's a very important conversation that we need to have ongoing, just to make sure that we're even letting prospective students that are interested in the University of Georgia know what our experience was like, what maybe put them in contact with current students at the University of Georgia to give them a perspective on what experience they could look to have at the University of Georgia, and especially in terms of public health, because us as people of color, us as women of color, we have so many health disparities that we're already dealing with. And so when we're bringing experiences into the classroom or bringing our experiences as alumni, it's important for us to be at the table, to be able to talk about, well, we know certain health elements or certain public health issues are going to be more prevalent and more detrimental to communities of color. And so we need to be there to talk about how it directly affects us, how we feel as a person of color would be the best way to disseminate the information that we're trying to get out to certain communities that maybe only we will know how to really connect with people on a certain level to get them to understand the importance of certain public health measures, and that it's important for us to continue to stay in public health so that we can be a resource to those and be visible so that people can say, hey, oh, so there are people who look like me that are out here trying to spread public health information, working directly with organizations and their participants. And it's just all about exposure and us being able to see each other doing certain things. So that's why I feel like it's very important to stay connected as alumni to the University of Georgia, the current undergraduates and prospective undergraduates.
I echo everything you just said. It is so important, which is why I've been committed to Georgia since 10 years ago when I graduated. I see that, we need to be a part, not only in giving monetarily, we do need your donations, but we also need some worker bees. Yes. So that leads me to one thing I wanted to share, but I'll save it to the end and I'll see if we have any comments before we start heading toward the close. Do we have any more comments, chat box?
No more.
All right. So when I made that point, I want to bring to your attention, if you're not aware, that we are getting ready to form, the Alumni Working Group, into the College of Public Health Board. And we are looking for you all that are excited and motivated about being a part of this board, being a part of the work that we do, as I shared from our mission statement earlier, intentionally engaging alumni, creating programming that fits the times of today to help our students and to help alums and stay connected with faculty and the college to continue to move the College of Public Health forward. So be on the lookout in your emails and your newsletter. If you're not getting that, please let us know that you're not getting that so that we can get you connected. This board will be standing up for the next fiscal year 2021. So that starts July. So please, if you're interested, please apply. We would love to receive your applications and hopefully have you on board if this fits your lifestyle right now. Also want to remind you the next Black Alumni Connection series will be June the 1st. We will have another alumni, Lanisha Scott. We are doing that one in recognizing Environmental Health Day, and she has an environmental health background. And so we want you to continue to come back. We want to share that with you so that you can go ahead and mark the calendar and be on the lookout for the board application and the next Black Alumni Connection series. At this time, I would like to ask Erika to give us some closing remarks.
Well, I would just like to say thank you again for inviting me to come and speak. When I received the call from Erika, I was just really blown away because I was like, who would be interested to hear my story? I mean, I just made a decision. I had to move forward and try to make a life for me and my child. So, but thinking back on my thought process at that time and the decisions I had to make, and it was very profound. It didn't seem that profound to me at 22, but at 45, almost 45, I'm like, wow, I really did have to just shift my whole focus. And so I just want people to understand and soon to be graduates to understand that, making a change, making a pivot, it's life. It's one of those bumps in the road. Things aren't going to go in a straight line all the time in life. You're going to have the hills, the curves, the valleys, the mountains, but as long as you remain flexible and open to trying different things, you will eventually find that niche for you that you can find passion in your work, and also at the same time, compensation that's going to be able to support your life and your lifestyle and for you to take care of your responsibilities. Just be flexible and pivot as you need to, and until you find where you're supposed to be.
Thank you so much. I want to check one final time for comments or questions in the chat box. Speak now, forever hold your peace.
No new ones.
No new ones? All right. Anyone from the working group has anything they want to add? Anything I left out?
No, great.
Go ahead, Kim.
No, I was just going to say great job. I've really enjoyed this. Thank y'all all for participating.
You're welcome.
Yes, and I want to echo Kim. Thank you, Erika, for your thoughts, words of wisdom. It's definitely very inspiring to all of us. So again, we really appreciate your time this afternoon. And thank you for everyone for joining.
My pleasure.
Thank you, everyone. We appreciate this. You coming on, continue to support, and we will look forward to seeing you next month at the next Black Alumni Connection series. Have a great evening and stay safe. Wear your mask.